Hi, I'm Sean Reel. Hot stone massage is quickly becoming one of the most popular forms of body work in spas and clinics. The video that you are about to see will give the beginning therapist everything they need to know to start practicing stone massage. And for the advanced therapist, we've included advanced stone layouts. Your instructor, Carol Ann Crichton, has been a massage therapist since 1980 and teaching nationally since 1993. She is the founding director of the Institute of the Healing Arts, located in Providence, Rhode Island. She has been developing this method of healing stone massage for many years. One thing that's unique about Carol Ann's style are the stones that she uses. Instead of choosing the mechanically shaped black basalt stones that you commonly see in images of stone massage, she chooses to use the denser metamorphic rocks because of their superior heat-retaining qualities. You will also notice that she uses large stones for the foundation layouts because the extra weight feels really good and that they hold heat for such a long time. If you already own a set of black basalt stones or prefer to use them for their aesthetic appeal, that's great. Just follow along in the video with the set of stones that you have. All of us at Real Bodywork are committed to offering educational videos of the highest quality. I hope you enjoy watching and that your clients enjoy receiving this wonderful modality.
Serenity,
Peace.
tranquility.
Hi, I'm Carol Ann Crichton. I'd like to welcome you to my Healing Stone massage video. Today we're going to discuss and review a basic massage sequence involving warm and hot stones for relaxation and well-being, a cool moonstone facial massage, and 6 restorative protocols that will help heal a variety of conditions using hot as well as hot and cold alternating stones and meridian tracing techniques. I'm also going to discuss today the different kinds of stones that are used in healing, the history of using stone in healing, contraindications to thermotherapy, and some different guidelines about the benefits that can be derived from this modality in combination with other modalities. Historically, stones have been used in healing for eons. The megaliths in Great Britain represent stones as needles into the earth, and they also talk about, there's history about hold stones imparting a special healing energy. In Asia and India, stones were used also with bones before there were needles to apply pressure to the energy system, the circulatory system called meridians. Native Americans and Japanese have used the stones in their culture and their healing modalities for years and years and years. So there's nothing new about this. What's different about healing stone massage therapy is that it combines many different modalities which have endured for centuries and eons, including hands-on massage techniques, thermotherapy, the vibrational energetic massage and body work, and aromatherapy. Stones possess a lot of geomagnetic properties after they've been embedded in the earth for eons. As you know, our Earth's poles are negative and positively charged, and the stones that are in the earth are imprinted with this polarity. As well, a lot of the stones that I work with contain high ore properties, meaning that there's metals such as copper and iron. And these ores contain and hold the heat and transfer the heat over a long period of time. So they're very durable as heat delivery agents. So basically, there are 3 kinds of stones on the planet, and those are sedimentary, igneous, and metamorphic. Sedimentary stones are actually more like compressed clay than a hard and durable stone. And I don't use it in healing stone therapy, primarily because after using some sedimentary stones once in a session and seeing them crack, I learned very quickly that they don't hold up to the heat and to the tension that sometimes is imparted in a session. The igneous stones are actually, if you translate the word igneous, igneous means fire formed, and these are from volcanic eruptions, and it's molten lava that has hardened. These are the basalt stones, and basalt stones are much more porous than the metamorphic rocks. They're very common around riverbeds, and they're used a lot more in the massage therapy in the western United States. I found at a metaphysical level that the river stones, the basalt river stones, have a very stimulating, intense kind of property. And being that I'm from New England and I was using my local stones, I've favored these stones, and these are the metamorphic granitic rocks. After consulting with geologists at the University of Rhode Island, I discovered some more properties that were astounding to me about these metamorphic stones. First of all, that they're very, very old. They're all over 300 to 600 million years old. And they come from a shoreline area in Rhode Island that at one point in time, way beyond my conceiving of time, was connected to Africa. So these stones are found in these two remote locations right now, part of New England and Africa. The granitic rock is the most durable rock, as I said. It doesn't change form while it changes its mineral content in the non-molten state. How this applies in healing use is that it will maintain its even heat for 30 to 45 minutes in a session. Also, there's a substantial weight and pressure, which is beneficial. You'll find when you're using these stones that the weight imparted is similar to that of a myofascial release technique. So it's very comforting and very focalizing to your client. I want to spend just a little time introducing you to the different shapes and the textures of the stones that I use in healing stone therapy. Not all stones that I use are selected because they're perfectly round and symmetrical. Actually, the opposite is true. I look for stones that are on the flatter side and have some curves to them that will fit into the natural contours of the body, and that when they're laid on the body will feel like a human hand. Also, the metamorphic stones that I work with come from the sea, and they have been smoothed by the salt and the waves. I never use stones that I buy at the store and that have been mechanically tumbled. The process actually interferes with the negative ions in the stones and reduces their potentiality to be healing stones. So I have in my stone set a whole variety of sizes and shapes. And when I go collecting the stones, I'm actually thinking of body parts and the shapes that correspond to them. We'll see later on in the session how a triangular stone will be applied to the sacrum because it looks like a sacrum. Or a heart-shaped stone will go right over the heart because it imparts healing to the heart center. Likewise, I like to use large round stones for working on the belly and the abdomen, and oblong-shaped stones for the lumbar spine. The palm stones, the ones that I use for massaging, are the ones that people think of when they see stone massage. The nice, smooth, black stones, and these can be either the basalt stones or also metamorphic stones that are in the right shape and size. The colors of the stones are also important for me. I like to use black, gray, and green. The green stones derive their color from a copper sulfide, and as you know, copper is a conductor of electricity. These stones actually stay hot the longest. Not everybody likes just a plain, smooth stone. When you're massaging with a stone that has some texture, a little bit of roughness to it, it actually exfoliates the skin, and when you wind it, or when you spin it over a tight muscle, it feels like you can really perceptibly uncoil the tension in the muscle. As a thermotherapy agent, stones retain the temperature that they are exposed to for long periods of time. In the case of healing stone therapy, I use 4 different temperatures. I use warm, hot, cool, and iced. And each temperature derives different benefits. And sometimes I use contrasts of hot and cold together to produce a vascular response. I use the warm stones, which are set to a temperature of about 80 to 110 degrees. And I use these in what I call restorative and foundation layouts on the body. And they apply a direct, sustained compress heat to the area that they're applied to for a long period of time. I use the hot stones, which are set at about 120 up to 135 degrees, depending on your client's tolerance of temperature. And I use these to keep in constant motion, and I use them as massaging. They trace the meridians, tonifying the meridian, and also into the muscle tissue, which will help to stimulate and tone the muscle and warm up the surface anatomy. The cool stones are body temperature and cooler, but not frozen, and they can be applied dry. I don't use any lubricant on the cool stones, and they're wonderful for reducing any kind of swelling, puffiness, and in a lymphatic drainage, light touch massage. The cold stones are actually quite cold, and they're frozen, and they're used the same way you would use ice. And because they're very cold, I don't use any lubrication, and I use a layer of barrier fabric in between the skin to prevent freezing. As extreme temperatures are going to be used in thermotherapy, I would just exercise the same precautions that you would in standard massage, but in addition to that, be aware of any open lesions on the skin, any rashes, or any infections, and avoid those areas. Also, it's not advised to use stone therapy or thermotherapy in certain cancers because it can spread the cancer, because this massage really increases venous dilation and circulation. Also, for cardiac patients with high or low blood pressure, I would stay within the moderate temperature range and avoid any of the extreme temperatures and the contrasts. Also, the elderly and children, their skin is hypersensitive and extra vulnerable to extreme temperatures and heat. So for these people, it's very, very soothing and comforting, but I would always just stay within the warm temperature range. And certain conditions, such as post-herpetic neuralgia and shingles, which really represent an inflammation, do not respond well to the extra heat provided. In general, just avoid any inflammations or use cool stones in those areas. As a prenatal precaution, we want to avoid raising the core temperature too high, so also stay with moderate temperature uses and with moderate depth of pressure with your massage. Okay, the benefits of healing stone massage are it increases circulation of blood, lymph, and vital energies. It improves the tone of the visceral organs, and it aids in elimination. It is a diaphoretic, which means that it produces sweating, and that helps to purify the blood. It strengthens and tones the yin, or hollow organs and conditions. At the same time, it reduces excess yang, or tension, in soft tissue and meridians. The heat increases joint mobility. The stones impart a sedating effect to the central nervous system, and the warm stones on the face relieve sinus pressure and pain. Overall, healing stone therapy brings awareness to the here and now and restores equilibrium to the body and the mind. Well, before you begin a healing stone session, it's real important that you be prepared and organized. The first thing you're going to want to do is to have a source of heat for your stones. I found that having 2 different stone heat sources is better than one because I do use the 2 different temperatures. I keep one set at 110 degrees, and that would be for my warm stones. The other heat source I set to 135 degrees, And this could vary on your unit, so you'll have to just keep adjusting it until you find the right temperature. I've never found that it's important to have tongs or rubber gloves or any kind of instruments to pull my stones out of the water. And the reason is that if the stone is too hot for you to touch, then it's going to be too hot to use. So I don't find that useful at all. Now I put the stones in water, and in order to keep your water sanitary and to avoid transferring viruses and bacteria from stone to client, you want to use a spa chemical, salt, or even an antibacterial soap, depending on the quantity of water that you have and how many clients you're going to be seeing each day. It is very important, however, that you wash your stones every single day at the end of your day with warm soapy water and then recharge them in nature very frequently. Okay, so you're going to fill your heat source about 3/4 of the way full with water and line the bottom with a towel. This is important because as you take stones in and out, they can get noisy, and you don't want to have that much distraction going on in the healing session. After your stone cools off, it's important to remember to put it back into the water so that it's hot. If your stones become too hot and you need to cool them down quickly, I keep a tub of water that's cold. It's best to use plastic or metal. A porcelain dish could break, and you wouldn't want to have that happening during your session. You may choose to put some aromatherapy oil into your water if that's desired, and some that I prefer for general relaxation are lavender, rose, orange, ylang-ylang, something along that line. Sometimes a fir needle oil essence is wonderful too. As in any massage therapy session, good client communication is important. And if it's a new client, you want to be thorough in your intake. You especially want to inform the client that you will be using extreme temperatures and that it's up to them to let you know of any discomfort during the session. We'll start with the client position face up, but first she will sit so that you can arrange several warm foundation stones on the massage table that she will lay over. These stones will go along each side of her spine from the sacral region to the upper back. Use medium-sized flat stones for this arrangement. This will prepare the back for later, deeper work, but it also sends signals of sedation to every nerve along the spine, which conveys immediate relaxation to the whole body. You'll want to stay in close communication with your client as she lays down over these stones for feedback on temperature and comfort. Continuing the foundation arrangement, you'll place 2 warm stones under each trapezius, and if you have flat stones for this placement, they can be inserted underneath the shoulder blades. I'm using more cylindrically shaped stones here, which also feels just like a neck roll, but in either case, you will need 1 more warm stone to place beneath the occipital ridge at the base of the skull. After you do that, then check in again with your client for feedback on comfort. Next, collect 2 warm hand-holding or touch stones. These should be more round than flat and large enough to allow the palm to lay outstretched over its surface without any effort. Now you're ready to place your restorative warm stones over the chest and abdomen. Since the skin of the torso is more vulnerable to heat, you should always touch the intended stones to the inside surface of your client's forearm prior to application for permission to proceed. If it's too hot, you just simply dip the stone into cold water for about 5 seconds and then retest. Start with a small to medium flat round. Gently press the stone into the body and hold it for a few breaths. This creates a gentle connection between heart and mind for your client. The next stones will be arranged along the central region of the body, which corresponds to glands, organs, and energy centers called chakras. Undrape the client and direct her attention to her breath by placing your hands lightly over her ribs and inviting her to breathe into your hands, followed by another breath into your hands, which you have moved to the belly. A large, flat, round, or oblong stone is best for the belly. At the top of her next inhalation, allow the stone to make contact with the skin, and as she exhales, the stone gently drops down fully into the abdomen. The weight of this stone serves to focalize her awareness directly into the body, away from mental distractions. It is also similar to the pressure applied in a myofascial release technique. This placement should be slightly below the navel center as it corresponds to the second chakra. Next, you will place another warm, round, flat stone over the xiphoid process, which corresponds to the solar plexus chakra, plus 2 small round stones over each ovary. It's important to place stones in direct contact with the skin rather than with a barrier layer of fabric for the maximum benefit to be received. Also, before you cover the stones with the body towel, place a smaller towel or cloth directly over them to absorb any excess water. Otherwise, the body towel will be uncomfortably damp against your client's skin later on in the session. Now, you'll continue onto the legs and undrape one leg at a time. Here, you'll place your anchor stones if you have large stones in your set, but if not, any warm, flat stones are fine. But more weight is preferred here, as this placement corresponds with the first, or root chakra, that conveys a sense of security and groundation to the body and mind. Select any small warm stone to be inserted under the back of the knee. Move back up to the head of the table and complete the chakral alignment by placing a very small, warm stone over the center of the brow. This is called the pineal or brow chakra, and the stone here effectively quiets the nerve impulses which interfere with the reception of intuition and mental clarity. As you place this stone, it is very important to be steady and slow in your movements to minimize agitation and to hold it for one full breath cycle before releasing your contact. Follow this with a similarly mindful placement of 2 small, warm sinus stones applied with direct sustained pressure for at least 1 breath cycle to the cheek. 1 drop of essential oil on each stone will impart an aromatherapy experience for the client if you prefer. Now all 7 chakras have your client's subtle focus, while the warmth deepens her relaxation. You'll begin the massage at this point by going to the feet. You start at the feet because you want to draw any excess mental energies down into the body, as the majority of stress has a mental component which leads to physical tensions and imbalance. Use your thumbs to work into the foot pad and arch. Work each toe thoroughly. And then take 2 small, hot palm stones. Sandwich the foot between these 2 stones. Deeply and slowly rub the stones from the toes up to the ankles, allowing the heat to penetrate into the tissues. Then you'll use the stone more specifically to apply small circles to the bottom of the foot. Now hold the stones in place, pausing to direct the heat and energy to the foot before you release. From your warm water, gather 4 small toe stones and insert one between each toe. Gently press the toes together with your palm to distribute the heat to the meridian source points located in the toes. Repeat this procedure on the other foot, including the massage with the stones, the placement of the 4 warm toe stones, and the ending toe squeeze to tone the meridians. Undrape the first leg and apply massage cream to the entire leg using long spreading strokes. Select 2 hot palm stones to massage the leg with. Cradling a stone in each palm, you'll massage with firm pressure up and down the lower leg. Next, make circular movements around the knee and along the thigh. Now hold the stone with your fingers and work more deeply into the thigh muscles. Remember to replace the hot stones often as they cool down. And if your stones are ever too hot, you may just dip them into the cold water very briefly to adjust the temperature. Getting it right is important and comes with practice. You want to blend correct temperature with correct pace and effective pressure to create a truly significant bodywork experience. Use the hot stones now to pull hand over hand down the thigh, continuing down the leg until you arrive at the ankle. Work around the ankle for a few moments and then release. Always replace the stones to the heat source when you have finished a segment. Now use your hands to apply Swedish-style massage to the leg. Using your thumbs, apply pressure into the lateral leg. Remember that as you are performing massage on the legs, the foundation stones are working to deepen your client's relaxation and erasing stress on many levels. Then work the thigh with your thumbs and palm. make circles into the lateral thigh with your thumbs, and apply a wringing motion to the thigh muscles, milking lactic acid out of the tissue. When you're finished, you'll recover that leg. Perform hot stone massage like this to the other leg and then move on to the arm. Effleurage some massage cream into the arm. I prefer cream over oil because oil can be too thin and superficial. Take 2 hot palm stones and use one to glide up and then back down the arm. The upward stroke is your intentional stroke, and the drag back down is your neutral stroke. This way you are working in the natural lymph drainage pathways. Switch hands now and use the other hot stone to massage in this manner along the inside of the arm. And then across the top of the deltoids to rest at the top of the shoulder, which will further promote lymphatic decongestion. Now remove the foundation trapezius stone or neck roll stone, whichever you're using, to gain access to the shoulder and neck anatomy. You'll want to massage into the trapezius with very firm pressure and a hot palm stone. Remember to keep returning your stones to the hot water for future use. At this time, you'll just apply the massage modality of your choice into the arm, working deeply into the tissues with your thumb. Always work the hands thoroughly, massaging each finger and the palmar reflexology points. So much of us hold a lot of stress in our hands from computer and other daily work. When completed, place your client's hand back over the foundation touchstone. The beauty of using metamorphic stones is that they retain their heat for long periods, so this stone will still be warm and soothing to the client. Now you'll uncover the torso carefully, tucking in the towel around your client's hips for comfort. You'll address the stones on her belly by initially massaging the dry, unlubricated stone's surface in a clockwise direction with 1 or 2 fingertips very lightly. This may not look effective, but the client feels every movement amplified through the stone as a perceptible undulating wave of energy or current. Move up to the next stone and apply the same technique to the diaphragm area. Your intention here is not that you are manipulating the opening of energy centers, but rather you're drawing the client's full awareness into her core body. All healing begins with such a shift in consciousness, and this is effective because it is effortless. Access the heart stone now and gently tap it with your fingertips. Again, the percussion will be felt vibrationally into this region of the body without overstimulating the mind. At the same time, the percussion will vitalize the thymus gland, which is central to a healthy immune system. Now, to release a stone, especially one with weight and substance to it, such as the belly stones, you'll want to wait until completion of the client's inhalation before lifting it up, which is timed with the top of her inhale. After you remove the belly stone, you oil it generously and replace it to its original placement, timed with the exhalation, as you did in the beginning. There is no need for verbal cueing about the breath pattern because your skilled calibration of stone to breath will convey the importance of a full deep breathing. Now begin to spin the stone in a clockwise direction. Again, this looks minimally effective, but it is actually a very potent therapeutic movement. Keep your circles even, steady, and slow. This movement enhances peristalsis and relaxation through the colon and small intestine. After several minutes, you'll lift off the stone plus any other stones that had been applied. The abdominal massage begins with a full palmar contact over the belly, gently kneading in a general wave-like manner. Next, focus the abdominal massage through your fingers, keeping all movements fluid and unintrusive. I avoid using finger points or tips in the abdomen, and instead use the softer pads of my fingers. Also, you'll want to integrate the side body into this massage by wrapping your hands around the sides of the hips and the ribs, pulling towards the core. A final integrating technique is to hold the heart stone and the belly while directing healing thoughts to your client. Redrape the abdomen and then move up to the neck and face. Take 2 hot palm stones and massage across the chest. Remember, this skin will already have been lubricated from the preparatory arm massage. Bring the stones around to the trapezius and up into the base of the skull. Hold steadily there to allow the heat to penetrate into the muscle tissue, relaxing her further. Now you will work up the back of the neck using firm pressure and being aware all the time of her anatomy. Stones work very well over soft tissue, but you will avoid bony prominences and spinous processes. Work the stone deeply into the occipital ridge and into the hairline. Then put those stones down and continue your massage of the scalp deeply with your fingers. Use your thumbs to apply pressure to just above the face at the hairline and simultaneously hook your index fingertips into the groove inside the orbit of each eye. Massage the temple and TMJ with your fingertips. And then remove the warm brow stone and press it gently into the crown of the head. Now touch the cheek stones and very lightly work them around the cheekbones and into the temple area. This is done without lotion or oil on the face. There are important acupressure points on the face that respond to the warmth, pressure, and energy of the stone massage. Gently glide along the eyebrows. and ever so lightly place these stones right over the eyes. Now gently place 2 medium warm stones over each ear as a buffer against any external stimulation and noise. This is a wonderful way to quiet the busy mind. Then use your fingertips to completely massage the face. If you like to work with a cream or lotion, it's fine to add it at this point. After you have worked over the ears and finished the facial massage, take a hot steam towel to which you have added a few drops of aromatherapy oil and wrap the face snugly. Place another steam towel across the chest. You want to give your client several breath cycles here to absorb the aroma and sensation of moist heat. As you remove these towels, feel that you're wiping away all the cares of the day. Next, you'll return to the feet and undrape one leg to remove the anchor stone. Then sweep down the leg to the foot and collect all the toe stones in this one sweeping motion. Redrape the leg and go to the other leg and repeat on that side. Remove the foundation stones from under the hands, and as the client sits up, you'll take away those stones from the massage table. There may be areas of hyperemia or increased circulation to the skin where those stones were, and this is beneficial. As she lays face down, you'll place a large warm stone over the sole of each foot. Then put a warm, medium round stone in each of her palms. Come up to the back and undrape the back, and begin by selecting a triangular warm stone for the sacrum. Be very sure that this stone is not too warm. The skin at the sacrum is extra vulnerable to heat. And if you have large stones, you would place 1 or 2 of them warm, not hot, across the lumbar back. If you don't have large stones, use the ones that you have in size-appropriate pairs to cover the paraspinal muscles of the entire back. Personally, I use larger stones here for their weight and consistent heat delivery. As an exception to my preference for weight, I will choose the lightest stone for the back of the neck. Remember, it's often uncomfortable for your client to place excess pressure on the back neck like this. My clients have often told me that it feels as though each stone is a human hand, nice and warm, and that even though I may be working in another part of the body, the stones on their back make them feel completely attended to. Finally, you want to include the buttocks where the large gluteal muscle group is found and where we store so much of our daily tension. Place your anchor stones here using either underwear or the towel to securely tuck them in place. Now cover the spinal stone layout with a small cloth before replacing the body towel over the back. Press momentarily into each stone to transfer the heat into that part of the back and to also assist your client in her focus in the body. Let's move now down to the leg. Apply your massage cream first to prepare and lubricate the surface. Take 2 hot palm stones and now massage them up the leg. Make circles using a hot stone petrissage movement over the back of the knee, flipping the stones often to keep the temperature consistent. You can also hold the stone in your fingers to apply a more focused heat and pressure. Now sweep the stones down the leg in a neutral returning stroke. And continue the leg massage with hot stones, replacing them as needed to maintain the heat, covering the entire surface and warming it thoroughly. Try to remember to pace your strokes slowly enough so that your client can savor the stone's texture as well as the heat. If you move too speedily, all the nuances of your stone are imperceptible. As you know, the benefit of working with stone is the induction of the grounding earth element to the overstimulated central nervous system. Earth energy is sedate and steady, and your massage with stones is likewise steady and sedating. After massaging both legs, you will cover them back up with a towel and integrate the work with lighter compressive touch to both legs. Let's return now to the back and remove the stones which have had some time, about 10 to 15 minutes, to prepare the muscles for deeper work. Rather than abruptly lift a stone up off of the body, it's best to maintain awareness of the client's breath rhythm and coordinate your flow accordingly. Just as the weight of the stones have been a comfort on the client's body, so is their removal, as it feels akin to the release of a heavy burden when this weight is taken away. After all stones are removed, apply massage cream with long, firm effleurage, which will transition into deeper Swedish-style massage strokes. Follow the lines of tension with your fingers noting them for future work with the hot stones. Now take 2 hot palm stones and apply a stone massage along those lines of tension and across the entire surface anatomy of the back and sides. The upper back is more heat tolerant than the lower back, so let's bear this in mind when applying hot stone massage. You'll be surprised to discover how wonderful a textured stone, even one that has some moderate roughness to it, feels when it is warmed and oiled and used in massage. I suggest that you vary your stones for this reason. This one that I'm using now is slightly exfoliating when moved over the skin, and when it is spun, it feels distinctly as though you're unwinding a coiled muscle. You'll leave the warm stone at the base of the spine while you integrate your deep tissue massage with some slow stroke spinal massage of the neck and back. When that is finished, remove the stone, cover the back with the towel. Your client is fully and deeply relaxed now due to the venous dilation and your massage techniques. To restore your client to a more alert wakefulness, use percussion down the back and legs all the way to the feet, where a brief hold will punctuate the session. For your final integration, you may choose to add an energy balancing modality, or simply stay present to your client as she shifts her awareness back to the here and now.
How much red skin is normal? When is it a burn?
There will be some slight redness on the skin after you've placed warm and hot stones there for a while. But in order to answer that question, I need to just talk for a moment about healing and health. In order for there to be health in the body, vital circulation is important. Circulation of blood and lymph can be impaired either through vascular constriction due to stress or congestion in the body from illness. So these stones actually increase the circulation, and sometimes the areas that need it the most will be the reddest. In order to know when too much is a burn, that will be determined by the client's comfort. If they tell you the stone is too hot, then it's too hot for them and you take it off. If they're comfortable with it, you're not burning them. And usually the redness will disappear by the end of the session.
What do I do if the stones roll off?
I usually place the stones in the foundational layout on dry skin. If you've already put lubrication on the skin, the stone will have a tendency to slip off. So what I do in that case is try to tuck it in with a towel or a pillowcase. And if it continues to fall off, you might try repositioning your client or moving on.
What if I forget to put the stones back in the heater?
It doesn't take long at all for the stones to heat up. It takes probably a minute, not even in some cases, so just put them back when you think of it.
How do I control the temperature during the sequence?
You can take the stone, if it's too hot, and put it in the cold water for about 30 seconds. It really changes the temperature quite quickly. Test it against the client's inner arm, and then if it's still too hot, try it again in the cold water for another 30 seconds. Likewise, if you have to raise the temperature from warm to hot, just insert it into the hot water. I'm going to demonstrate a restorative and cooling treatment which includes the Moonstone facial massage. First, I will place 2 medium-sized cool white stones over the lymphatic collection sites in the lower torso and also in the chest. I recommend placing cool stones in the hands only as a short-term therapy for achiness in the fingers due to carpal tunnel or arthritic syndromes, and always in adjunctive combination with the basic warm hand-rest stones. Now tuck the lymphatic stones in with your towel or inside the client's robe so that they're secure. Begin your cooling facial treatment with a skin cleansing method of your choice, which will warm and increase the circulation to the face and neck, followed with this gentle massage using chilled moonstones. Thermotherapy utilizes alternating extremes of temperature to produce a vascular flushing which will clarify the tone of the skin, but always remember that facial skin is more vulnerable to temperature extremes, and try to stay within the warm and cool range, never using very hot or frozen stones directly on facial skin. Always keep your movements fluid and steady. Any movement of massage applied to the face will be amplified by the central nervous system. So as a practitioner, you will need to develop a steady hand and focus yourself. Cool stones are always used without lotion because the pressure applied is minimal and lubrication is not required. Also, it can feel somewhat unpleasant and clammy. Larger stones placed over the cheeks and forehead are effective in reducing sinus pain and pressure. Hold these cool stones very lightly over the eyes to bring relief to any eye strain that happens as a result of long hours at a computer. Stroke upward to rejuvenate the face and throat. White stones are best used in cooling treatments because they don't retain heat well. They do aid in reducing fever and in balancing body temperature, or thermogenesis. The gentle massage strokes on the face, along with cold temperature, creates a firmness to the skin tone and reduces puffiness. Also stroke the arms toward the lymphatic collection sites. Bring the cooling facial sequence to completion with the laying on of one stone to the third eye chakra, while peacefully holding two more over the cheeks. According to laws of polarity, and also according to the ancient Ayurvedic principles, bringing coolness to the face and head is beneficial to promoting balance in the whole body, especially for anyone with a fiery, passionate nature, or in general during the hot summer months. I am sure your clients will feel the pacifying properties of cool ocean water washing away the buildup of excess mental energy while enjoying the beautifying moonstone facial that you give them. In each protocol, the first thing to do is to assess your client and determine constitutionally what's going on and what needs to be addressed to achieve balance. Each of the restorative protocols will include a foundation layout, and then the therapist will trace a specific meridian using a hot stone. The restorative protocol for the lung meridian will help asthma, upper respiratory congestion, colds, protruding or painful shoulder blades, difficulty or pain holding their arms overhead or doing work overhead, if they're going through a grief process, or if the weather is cold, dry, and windy. Here are the toning points for the stone placements. The tracing of the meridian would go down the arms from the node area to the thumb. For the lung meridian, we only use hot and warm stones, no cold stones here. After you've traced the meridian on each side 3 times, then apply a warm stone to the inside of the elbow, which is a very important point for the immune system, and use a self-adhesive elastic bandage to keep it in place. The next restorative protocol is for the bladder and spleen meridian and focuses on the second chakra area. Perform this protocol if the client has menstrual cramps or has a history of recurrent pain related to the menstruation, low back pain, a rounded spine, uneven shoulders, pigeon-toed or fallen arches, and in general for the winter or cold, damp conditions. Here are the toning and restorative points. First, clear the spleen meridian by using a hot stone to trace up along inside of the leg. Then over the lateral torso, and finally ending near the armpit. place a large stone over the thigh. If you don't have such a large stone in your set of stones, you can simply use 2 smaller or medium-sized stones right here. Then attach a smaller stone to the inside of the knee and use your self-adhesive elastic bandage to keep it in place. Do the same thing to the other leg because meridians are in pairs. Now move up to the head. From this position, begin tracing the bladder meridian from the inside of the eye to the forehead and the top of the head. Tracing down to the temples and then around the ear. Move down the back of the neck on both sides. To complete the bladder meridian, you'll have your client turn over and trace next to the spine, down the back, about 2 fingers width off of the spine. Now over the hips and down the backs of the legs. Your movement should feel as if you're pulling a bead under a blanket. Move over the inside of the ankle and finish by drawing out the first toe. You may place a large flat warm stone over the toning point for the bladder meridian as an alternative to tracing the bladder meridian. Remember that you can always incorporate the basic stone massage into these layouts. For example, now would be a good time to perform some massage. The restorative protocol for the stomach meridian, which is a positive yang meridian, would be indicated to increase the digestive fire or agni before meal, to treat nausea that's related to chemotherapy or pregnancy, an unlevel head, mental intensity and much worry, or in helping to treat an ulcer or stress-related indigestion of a chronic nature. Here are the toning points for the stomach meridian. We use only warm and hot stones. Tracing the stomach meridian runs downward from just below the eye, traces the jawline down to the temple, over the cheek and neck, trace out from the clavicle, moving down just lateral to the sternum, then over the ribs and lateral belly. Now move down the center of the thigh, and jog laterally onto the lower leg, tracing down just next to the tibia. And remember, because you're tracing a meridian with a stone rather than an acupuncture needle, it's not critical if you fall slightly off the meridian. complete by coming off the second toe. We trace the meridian with a hot stone 3 times. The restorative protocol for the liver meridian will help to increase nourishing and cleansing flow of blood to the bile ducts and liver, and to increase hepatic rejuvenation. Assess this need in a client by looking and observing the skin tone. Yellow skin tone or flushed red cheeks often indicate overheated liver. High cholesterol, chronic anger, hormone imbalance, rounded cavitated chest, relationship difficulties, and intolerance of weakness in others all correlate to excessive liver heat. Here are the toning and restorative points. Cool moonstones gently placed over the eyes and forehead should only be applied to the client who is not wearing contact lenses. Bringing coolness to the face and eyes is beneficial to promoting balance in the whole body, especially for the liver. The restorative points at the liver begin with warm stones, and we alternate with cool. Every 60 seconds replacing the stone, ending with a warm stone. The liver meridian starts at the inside of the big toe. To trace the liver meridian, use a warm stone and trace up the inside of the foot and inside of the leg. Keep the pressure steady and smoothly glide up the inside of the thigh. Then move laterally and trace up the side of the torso. Complete by holding over the lateral ribs, directing energy into the liver and spleen on the left side. The restorative protocol for the intestines will help your clients with bloating, irritable bowel syndrome, and upset digestion. Finding out if they've recently taken antibiotics, if they're under a lot of stress, an exaggerated lumbar curve, a distended belly, and it's used in summer and late summer seasons. The toning and restorative points for the intestines cover almost the entire front of the body. We'll trace the small intestine meridian starting at the little finger. This meridian moves upward along the outside of the arm. It goes along the shoulder, up the neck, to the side of the mouth. It moves up towards and ends at the top of the ear. And finally, for the kidney, which is a negative yin meridian, this is indicated for low back pain, indecision, fear, extreme fatigue and exhaustion, and addictions. Assess this in your client by observing the lumbar spine. If it's flattened and there's no curve, or dark eye circles, extreme thirst, dark urination, diabetes, urinary tract infection, or kidney stone now or in the past, and if it's the winter season. Here are the restorative and toning points. The kidneys respond wonderfully to warmth, so we never use cold stones on any of the meridian points for the kidney. After the stones have been working for at least 5 minutes, you can turn the client over and place a nice warm stone under each arch and use those adhesive stretch bandages to hold the stone in place. Then trace the kidney meridian by gliding up from the bottom of the foot along the inside of the leg. Keep moving steadily up along the inside of the thigh, using focus and intention to work with this energy. Remember to repeat this motion 3 times and on each side of the body. You'll move up and toward the center line of the body, into the torso, just about an inch lateral to the center line. Continue tracing up just next to the sternum and end beneath the clavicle. That concludes the Healing Stone Massage video. Good luck with your practice. I hope you enjoyed watching, and I hope you will enjoy sharing this wonderful work with your clients and friends.
In order to perform stone massage, you'll need a set of good quality, high ore content, and naturally formed metamorphic stones like these. The essential set, pictured here, consists of 24 stones: 8 toe stones, 3 facial moonstones, a neck stone, belly stone, and heart stone. Also included are 2 flat stones, 2 hand rest stones, 2 shoulder blade stones, and 2 massaging rounds. These stones have been hand-picked by Carol Ann and Stone Temple Bodywork. If you're interested in purchasing this set or other stone sets, please call Stone Temple Bodywork at 866-409-2900 or visit healingstonemassage.com. If you're interested in continuing your education, Carol Ann hosts certification training in healing stone massage. If you would like to have Carol Ann teach a certification workshop at your school or spa, or want information on trainings that are currently scheduled, again, call Stone Temple Bodywork toll-free or visit Healing Stone Massage. Real Bodywork has a complete line of high-quality educational massage videos. Our website, realbodywork.com, has over 70 pages of information from lymphatic drainage techniques to neuromuscular therapy and trigger points. You can see video clips of various types of massage and learn more about your favorite modalities. Visit realbodywork.com for more information on stone massage and many other modalities, or call 888-505-5511. Some of our other videos include lymphatic drainage massage, deep tissue and neuromuscular therapy, the torso, deep tissue and neuromuscular therapy, the extremities, heal your wrist pain naturally, and beginning myofascial release.